The prostate is a small gland about the size of a walnut located just below the bladder in men. This gland plays a crucial role because it produces the fluid that makes up part of seminal fluid. As men age, the prostate can enlarge. This condition is called benign prostatic hyperplasia, or BPH, when the enlargement becomes significant enough to cause problems. It's important to note that BPH is benign. This means it is not cancer and does not lead to cancer. However, BPH and cancer can sometimes happen at the same time. Before we delve further into the specifics of BPH, let's take a moment to look at the key risk factors that can contribute to its development. Understanding these factors is crucial for proactive management and early detection. While BPH can affect many men, there are several factors that can elevate the likelihood of developing this condition. Some men are statistically at a higher risk than others. For example, men over 50 years old have a higher risk of BPH, and this risk typically increases steadily as age advances. The aging process itself plays a significant role. This risk is also higher if a father or any other close male relative had BPH. A family history can predispose you to the condition. People who are overweight or obese are also more likely to develop BPH. Maintaining a healthy weight is important for overall health, including prostate health. Furthermore, men who are not physically active may face an increased risk, as well as some men who experience erectile dysfunction. Lifestyle choices can have a direct impact. At this point, if you want to support the channel and help us create more informative content, please subscribe and turn on the bell to give us strength and never miss out on future updates. Also, do you know anyone who has ever had prostate symptoms or been diagnosed with BPH? Share your personal experience or insights in the comments section below. Your contributions can help others. Let's explore the signs and symptoms of BPH. Urinary frequency, needing to urinate often, especially at night, is a common sign. This happens because the enlarged prostate puts pressure on the urethra. Another frequent symptom is urgency. This is a strong and sudden urge to urinate even when the bladder is not full. Urgency can disrupt daily life and lead to incontinence. Urinary frequency and urgency can also be caused by other conditions, highlighting the importance of a medical assessment. A weak or slow urine stream is a common and often noticeable sign that something might not be quite right with your urinary system. It's a deviation from the normal, forceful flow you're used to. This can be especially noticeable at the start of urination, where the stream struggles to gain momentum. You might find yourself waiting longer for the flow to begin. A weak stream makes it hard to empty the bladder completely. This incomplete emptying leads to urinary retention, where some urine remains in the bladder even after you've finished urinating. This symptom can be incredibly frustrating. The feeling that the bladder is never fully emptied can lead to frequent trips to the bathroom, disrupting your daily life and causing considerable discomfort. Furthermore, it also increases the risk of developing urinary tract infections, as the retained urine can become a breeding ground for bacteria. It can also contribute to the formation of bladder stones and even lead to incontinence over time. Interrupted urine flow, characterized by a start and stop pattern, is another important sign to watch out for. The flow may start and stop several times during urination, often unexpectedly. This intermittent flow pattern shows that the urethra, the tube that carries urine out of the body, is likely partially blocked. This issue can also be caused by an infection within the urinary tract, inflammation of the prostate gland, a nervous system disorder affecting bladder control, a pelvic muscle problem that weakens support, or sometimes even as a side effect of surgery in the pelvic region. One of the hallmark indicators of BPH, or benign prostatic hyperplasia, is the inability to completely empty the bladder. This is often referred to as incomplete emptying, and it's a very common complaint among men as they age. This sensation can be quite frustrating as it leaves you feeling like you haven't fully relieved yourself, even immediately after urinating. It's a persistent feeling of fullness, a nagging sense that something is still there, and this can significantly impact your daily life and overall comfort. It can disrupt your sleep, affect your concentration, and generally lower your quality of life. As the prostate enlarges, a natural part of aging for many men, it can put pressure on the urethra, the tube that carries urine from the bladder. This pressure constricts the urethra, making it harder for urine to flow freely. Some men with BPH experience a more severe form of this, where they cannot empty their bladder at all, leading to acute urinary retention. This is a serious condition that requires immediate medical attention, as the bladder becomes overly full, distended, and painful. It's a medical emergency that needs prompt treatment to prevent potential damage to the bladder and kidneys. Another common symptom is dribbling. This is the involuntary leakage of urine that occurs after you've finished urinating. It can be a few drops, a persistent trickle, or a more significant amount, but either way it can be quite bothersome and inconvenient. It can stain clothing, cause odor, and lead to feelings of self-consciousness. This frustrating dribbling happens because the enlarged prostate presses on the urethra, the tube responsible for carrying urine out of the body, and makes it hard for urine to flow out completely. The enlarged prostate essentially acts like a clamp, restricting the normal flow and leading to residual urine that remains trapped in the urethra after urination. This residual urine then slowly leaks out, causing the dribbling. As a result of this pressure and incomplete emptying, some men with BPH experience that annoying dribbling after they think they've finished urinating and are walking away from the toilet. It's an unwelcome surprise that can disrupt your day, forcing you to change clothes or constantly worry about potential accidents. Often, it feels like there is still urine left in the urethra, even after you've tried to empty your bladder completely. This sensation of incomplete emptying contributes to the urge to urinate frequently, even if you've just gone, and the discomfort associated with BPH. It's a constant reminder of the problem, leading to anxiety and frustration. This persistent dribbling can be incredibly embarrassing, and in some cases can lead to incontinence, which is the loss of bladder control. This can significantly impact a man's confidence in social life, making him hesitant to participate in activities or travel far from a bathroom. It can also affect intimacy and relationships. Furthermore, the constant dampness can also increase the risk of skin irritation in the surrounding area, leading to rashes, itching, and discomfort. And the retained urine in the bladder creates a breeding ground for bacteria, leading to painful and uncomfortable urinary tract infections. Again, it's important to remember that BPH can significantly increase the risk of developing urinary tract infections because of the urine buildup that occurs in the bladder. This stagnant urine provides an ideal environment for bacteria to thrive and multiply, leading to recurrent infections that can be difficult to treat. In addition to these symptoms, sometimes men with BPH may also experience pain or a burning sensation while urinating, further adding to the discomfort and frustration associated with this condition. This burning sensation is often a sign of inflammation or infection within the urinary tract and should be evaluated by a doctor. Blood in the urine is a symptom that should never be ignored. Also called hematuria, it can be a sign of benign prostatic hyperplasia, or BPH. BPH can cause the prostate to press on the urethra, which can lead to irritation and inflammation. Keep in mind, blood in the urine can also be a sign of a more serious condition like prostate cancer. Not all men with BPH will have all these symptoms. If you are experiencing any of these symptoms, it is essential to see a doctor for evaluation and treatment. Don't forget to like, comment, and subscribe to the channel to stay updated and support our work.